Shallow water rescues. The following are the rescue techniques used to secure the inline stabilization of the spine of a victim to ensure that no further damage is done. Keep in mind, during these rescues, the victim should have a pulse and should be breathing. If the victim does not show signs of life, advanced medical care needs to be administered immediately. Arm clamp face up. Step 1. Making as little movement as possible, approach the victim from the front so that their head is positioned toward your chest. Step 2. Grasp the victim's arms in between the elbow joint and the armpit, positioning your hands so that the palms are facing up. Step 3. Once you have grasped the victim's arms, slowly rotate the shoulders so that the arms clamp inward toward you, making a smaller and smaller angle. Make sure to duck under the arms while clamping them inward. Step 4. Securely clamp the victim's arms so that they are touching the sides of the head. Slightly bring the victim to one side so that their head is directly above your elbow joint. Arm clamp face down. Step 1. Approach the victim from the side, making as little movement as possible. Step 2. Grasp the victim's arms in between the elbow joint and the armpit. Position your hands so that the palms are facing down this time. You should be reaching over the victim with one arm, right to right, left to left. Step 3. Slowly close the arms so that they clamp the sides of the victim's head and neck. Step 4. In a fluid forward motion, rotate the victim 180 degrees on their axis, pressing the arm closest to you underwater to rotate the victim face up. Note, rescuer should not go underwater or change standing position. Step 5. Make sure to be level with the victim in the water. Continue a forward motion to keep the victim as horizontal as possible until help arrives. Forearm clamp face up. Step 1. Approach the victim from the side, making as little movement as possible. Step 2. Place the victim's arms to their sides. Step 3. Place one forearm underwater on the victim's back. Your forearm should be resting straight down the center of the victim's spine with your hand on the back of the victim's head. Make sure not to place your hand on the victim's neck. Step 4. Place the opposite forearm straight down the victim's chest with the hand on the victim's chin just below their mouth so that they may breathe. Step 5. Remaining at the same level as the victim in the water, continue stabilizing the neck while maintaining forward motion to keep the victim as horizontal as possible until help arrives. Forearm clamp face down. Step 1. Approach the victim from the side, making as little movement as possible. Step 2. Place the victim's arms to their sides. Step 3. Place one forearm underwater straight down the victim's chest with your hand on the victim's chin, just below their mouth. Step 4. Place the opposite forearm on the victim's back with your hand on the back of the head. Step 5. Once the victim is secure, submerge and rotate under the victim. Make sure to keep a tight clamp with your forearms during the rotation. When you surface, you should be on the opposite side of the victim, and the victim should now be face up. It is key to maintain stabilization during the rotation so that the rotation of the head or neck does not occur.